This lady actually was here last week. We did her upper and lower abdomen, and very frequently I'll split up several areas over 2 days. Today we're going to do the bra line, or really lateral back area, and the flank areas. And they're just going to be 3 little incisions per side. They're only about 2 millimeters. There's the place where I'll locate for the bra line. Sometimes people have several folds and they'll have to put more than 1 incision, a little incision here and a little incision here. And what I'm starting off to do now, this is hibiclans, which is an antiseptic. By the way, she's wide awake. She has some Ativan, makes her a little sleepy, but she's not asleep. It's a little cold. So I'm just prepping her up. And shortly thereafter, we're going to put towels that are all sterile, and then we'll start the procedure. So I've now prepped her and draped her. You can see it's all sterile drapes. This is the cannula that goes to an IV bag. Whenever I step in the pedal, it's just going to fill up this area with the local. Nobody's resistant to it. Everybody gets numb. What's also wonderful about this lady is she's going to try and do the diet that I recommend. Because there is no magic, the SmartLipo or laser lipo will definitely decrease her fat. But again, if you want to look your best, there's no magic. If you modify your diet and decrease your body fat, you're going to enhance the results that I do. And I have a very specific diet, which I think is great. I've been on it for a couple years, and I have a lot of patients doing it that I think can really help decrease your body fat. Laser the bra area, the lateral back, and now I'm doing the lasering in the flank or love handles. So I just go back and forth for quite some time. You hear the clicking, that's the laser firing multiple times a second, and that's targeting the fat and melting the fat. And then the final step will be when I suck out the fat. Laser this area, and this area, actually all 4 areas on her back, the 2 lateral back areas or bra areas and the flanks. Now I'm about to start the lipo. And again, as you can see, it's a very gentle movement, and I'll just go back and forth, and you can see the fat coming out the tubes. And it's a small amount, so it's a much slower, more delicate process, but she's completely awake. She's a little relaxed because of the Ativan. But she'll be able to return to work tomorrow. She'll be up walking today. Just can't drive today or, sign any contracts. But this should be a very easy procedure for her. And I just go back and forth very gently. And I like to use 2 incisions in the flank so I can kind of crisscross the areas. Bra area, I like to use a smaller cannula. It's a little more delicate. There's less fat for most people in this area. And again, it's always a gentle movement. And I'm always using my other hand to guide it. I have a lot of experience. I think we've done 12 or 1,300 of these now. And then when I'm done, I'll close this very tiny incision with a dissolving suture. There'll be a very tiny scar, but it should be quite imperceptible.